Peter Chirico with Chirico Physical Therapy and Wellness, and today we're going to go over what to do if you've had a total hip replacement and you're still having pain. So yes, you've had the total hip replacement, and more than likely the total hip replacement itself is fine. If not, your physician would have caught it. If there's some kind of mechanical flaw with the implant itself or something like that. But if you've been cleared that the cement is fine, the bone is healing, and the implant itself is intact and working properly, then that's good. The problem is you're still having pain. We see quite a bit of this. Patients are referred to therapy and they're still having intense pain in their hip, thigh, or groin regions. And whether that's myofascia or not, we don't know. But the problem is that your total hip replacement is fine, but no one knows what to do. Now, there is an answer to this. You have to solve the root cause of what is causing the pain. Some people have had a total hip replacement because they had an arthritic-like hip that affected their pelvis, and they have a pelvic tilt. So even though the hip has been replaced, they still have a pelvic tilt. This can cause some SI joint problems, some low back problems, and some anterior hip problems, kind of like a hip impingement. The other thing that can affect that area is the hip flexors can cause anterior hip pain. The other thing that is common with these kinds of problems is that there can be pain in the groin, thigh, and hip area. And a lot of times these people are diagnosed with an IT band syndrome or a lateral hip bursitis type diagnosis. So yes, we know you have the pain, but we need to know what is really causing it. So this goes back to, are the range of motions correct? Are the strengths adequate? Is the endurance sufficient? When you stand and walk, are your biomechanics breaking down, thus causing a diagnosis of a hip impingement or pinched hip, groin pain, or IT band syndromes? This could be the second cause of what's going on. The third cause of what could be going on is missed by a lot of people, and that is, do you have a new leg length after your total hip replacement? Do you stand awkwardly, and do you have pain either on your involved hip replacement side or on the opposite side? These can also be a third cause of why you're having pain and what's going on. So the point of the video is there is hope. All we have to do is solve the root cause of the problem. So is it your low back, your SI joint, or some myofascial hip pain? Are the mechanics of your standing and walking affected by the total hip replacement, thus giving you difficulty and pain with those activities? So there's a lot of questions here to be answered for you. If you're still suffering from having pain after your total hip replacement or have a new pain, give us a call. We can get you in for a thorough evaluation and determine what the root cause of your pain is. Our telephone number is area code 909-345-3370, or you can contact us through our website at chiricopt.com. And I want to thank you for your time. Bye-bye.